Welcome to today's episode of Heart of the Hustle. I'm here today with Sara from Platinum Patient Advocates. She is an advocate for people who are going into cardiac surgery and just need help kind of figuring out how do you navigate the medical system. It's such a big, scary thing. And now that I know Sara, I can't even imagine trying to go into surgery without having a patient advocate. So we're going to talk to her a little bit today about what it means to be a patient advocate, why you need one, and kind of what she specializes in. And I promise you, if you're ever going into any kind of surgery, you're going to want her or someone just like her. So welcome.
Hi, thanks for having me.
So excited you're here. So Sara and I have known each other for a little while, but she flew all the way in from Montana just to come and hang out with me in the Heart of the Hustle studio. So I'm so glad you're here.
So excited to be here.
So tell me a little bit about what a patient advocate is.
So a patient advocate is a person that has your best interest at heart. So, we work privately with patients undergoing any kind of medical procedure or just normal medical follow-up to make sure that everything's being done correctly, to make sure that the patient is communicating directly with their doctor, understanding everything that's being said, understanding what medications they're on and why, and helping to streamline the medical their medical journey, make it as easy as possible and make sure they're getting the best treatment possible.
Because it's overwhelming.
It is. Yeah. The medical system is crazy and it's really hard to understand what you're going through, even if it's the smallest process to the largest.
Yeah, one of the things that I have other clients who are doing like direct primary care and so forth. And I think one of the reasons is the medical system is set up such now that you're not allowed to spend a lot of time with your patients. And
Right.
So explaining things is really challenging. And I think, is that the role that a patient advocate helps with?
Exactly. Yeah. Doctors are so stripped for time. They have these allotments of 10 to 15 minute increments that they can spend with patients. So much is rushed and they don't have the time to explain and make sure the patients, all their questions are answered or that they understand everything that's going on. So patient advocates really can fill that role and make sure that nothing's missed, that the patient understands everything that's being communicated with them and really take that time with the patient that the physician or the medical provider isn't able to take.
Right. And so you're kind of it's almost a stopgap between the doctor, or translator, right? Between
Exactly.
the doctor and the patient when the doctor or the other medical professionals just don't have time to do it.
Exactly. Yes.
And so what's your background?
So I have been a physician assistant working in cardiac surgery for over a decade now. I've worked with multiple different hospitals, big and small community hospitals, and seen pretty much every kind of cardiac surgery that can take place. Worked with tons of patients over the years undergoing a multitude of different issues.
So what inspired you to start Platinum Patient Advocates?
What really inspired me to start Platinum Patient Advocates was all of my patients that were undergoing surgery and everyone that I saw in the hospital. There's so many of them that just didn't understand, even going into surgery, what was being done or why it was being done. And then after surgery, the discharge process and going home, and they were so lost in, what do I do now? How do I follow up? Who do I follow up with? And I decided to take on a different role and really be there from the beginning to the end with the patients and be able to help them through that journey.
Yeah, because I know from personal surgeries, like they send you out of the hospital and you're sort of trying to figure it out on your own, right? You might have one little sheet that they gave you when you were too loopy to be able to read it.
Exactly. And all of those discharge, depending on who does your discharge, you might just be thrown out with that piece of paper with nothing explained to you. And so I've heard from so many different people that exactly that they get home and they're just treading water, not knowing which direction to go. So having somebody there that's been there, that knows the system is so important and so helpful.
And I have to imagine the outcome's better
Oh, definitely. And they've done studies that patients with patient advocates do better over time because they have better follow-up. They have a better understanding of their disease, and they just take better care of themselves overall.
Yeah, yeah, that's cool. How do you think, because you've been in the cardiac surgery world, right? How has that really informed the way that you handle your clients, or your patients rather, as a patient advocate?
Being a physician assistant in cardiac surgery, it gives me such a unique perspective. I've been there from the pre-ops to the operating room to the ICU and the post-op floor. And so it really is helpful to know what goes on each step of the way, how that's dealt with from a doctor standpoint, from a nursing standpoint, from an administration standpoint. So it's really nice to go in with patients and be able to give them that background information, and just lead them through that and be able to get them the best care possible, because being in there in the past, I know what to ask for and what to advocate for my patients and what's available to them.
Yeah, that's amazing. That's a great resource. What are some of the biggest concerns that people have? They've been told that they need cardiac surgery. What are the biggest types of concerns that they have?
So I think the first and foremost is fear. Anytime you go into surgery, it's just natural to have that fearfulness of what's going to happen. What does the surgery consist of? How am I going to recover? How's the pain going to be? And then, who's going to take care of me afterwards? And am I going to be a burden to my family, to my friends? And so I think the best way to deal with that is just being informed, knowing going in, this is what the process is. These are the steps. These are the possible complications, and how are we going to solve those? And then really informing the family as well, so that they know what their responsibilities are and how to support the patient.
You have to imagine, do you spend a lot of time working with the families?
Yes, definitely. I think that's one of the biggest things I'm able to offer, is giving the patients and their families that support. Because when you're undergoing surgery, you're asleep. It's your patients or your family that's out there in the waiting room that are worried, that don't know what's going on, what the next steps are. So being able to support the families as well as the patients is huge.
Yeah. What are some of the ways that you do that, just emotionally keep them from losing their minds while their loved one is in surgery?
I think, again, one of the biggest ways to conquer that fear is to have knowledge. And so being able to say, this is the point of surgery they're in. This is what they're doing right now. This is what to expect. And they'll come out and talk to you in a little bit. And, this is where the patient's going to go afterwards. And just being able to really, decrease those fears for the patients.
So are you with them actually at the surgery? So are you sitting in the lobby with the family members? How does that work?
So a lot of times I'll be in the waiting room with the family members and be able to take those calls from the nurses or the doctor and explain to them what's happening. Because a lot of times it's just a rushed call from the OR to update the family, and they don't really understand what that means. So being able to describe to them where they are in surgery and what the nurse just said and what that means is really huge and can help manage a lot of those fears and anxiety.
Yeah, because how long does the average cardiac surgery take?
It really depends on what the surgery is, but I'd say average 4 to 6 hours.
Wow. What are the different types of cardiac surgery that you can undergo?
Really anything. There's all kinds of valve surgery. So we've got mitral valve surgery, aortic valve surgery, CABG, which is coronary artery bypass grafting. And then if you have specialized centers, you can do transplants, or we have VADs, which are ventricular assist devices, which help to run the heart when the heart's not working. So really there's a ton of different surgeries that can be done.
We talked a little bit about the families and how you help with their fears, but how do you help the actual patient kind of deal with their fears and their anxieties? What's your approach to that?
So again, it's all about knowledge and knowing what you're doing going into the surgery. That really helps. So explaining, I love getting in the beginning with the patient, so I can be there during their pre-op appointments, ask all the questions, make sure the surgeon's explaining in detail, and making sure that if the patient doesn't understand what's going on, they know enough to ask those questions going forward. And then, day of surgery is so scary. So knowing this is where we're going, I don't need to search around for the place in the hospital that I'm going to be admitted, knowing what to pack, knowing who can be there and when they can be there, and then just getting a general idea of what's going on in the hospital. And then after discharge, that's really important to know even before you go in the hospital, so you can start getting your home ready for what you're going to need after you get out of the hospital.
Yeah, it's so valuable. Okay, so one of the things that I imagine that an advocate's really helpful with is like navigating the healthcare system, because it's so complicated and there's so many different people involved. And so tell us a little bit about how you help people to navigate the healthcare system.
So that's one of the main things I do. People don't realize that they can get second opinions or even who to go to for that. So I do a lot of the research of who's the best doctor for this procedure or this problem that you have. Who can you talk to? Are there social workers available? Is there home health nurses available? All of the things that people don't, unless you work in the healthcare system, don't know are available to you. And I'm able to get that all set up and introduce my clients to the people that can help them, make sure that their disease process is researched. Are you getting the best treatment for this? Because there's always, as you know, there's always new advances every day. And so are you getting the best treatment for your disease?
Yeah, and you're not going to go reading all the journals. Even if you tried, you don't understand.
So that's what I do is I go look at what's the newest and best and who's doing it and where can we go for those things.
Yeah. How do you help people sort of who are overwhelmed with all the jargon and that's the biggest challenge, I would imagine, is just, your doctors are talking Greek to you, right?
Exactly. Medical jargon is a whole different language, and doctors don't even realize that they're speaking it when they're talking to patients. And so that's one of the things is making sure you slow down your provider. Hey, can you explain that again? I didn't understand what you were talking about. Or after the appointment, I'm there. I can go over what they said and what that means and explain things so that the patient understands and really knows what's going on and what was said to them.
Yeah, because I think sometimes you just go into autopilot when you're in those meetings, right? Especially if it's something that's highly emotional, you're really in fear, right? Your brain just turns off.
Exactly. And there's so much information being thrown at you during your 15-minute visit. And patients also feel fearful of asking more questions because they don't want to take up the time of their provider. And so it's really important to understand that that's their job. You need to ask them questions. And then if you don't understand anything or understand what have been said, make sure you ask someone that was there. They say that about 20 to 30% of what patients are told just goes in one ear and out the other, just because of the amount of information that's being thrown at them. And so having someone there with you, having a patient advocate there that understands what's going on, can take notes and then can explain it to you afterwards and really reiterate what the doctor was saying is so important.
And you don't have to be in person to do that, right? For a lot of these, you can just be on the phone or, connecting on Zoom because you have patients all over the country.
Exactly. Yes. A lot of them I'm just called in or I'm on Zoom, but I'm there for the appointment. So I know what was said and I'm able to discuss that with the patient and really help them coordinate their care and understand their care.
And probably ask questions that they don't even know that they should be asking.
Exactly. So before the appointments, usually we have a pre-meeting with my patients where we go over, okay, what do you want to know? What kind of questions should we be answering or should we be asking? And we have a list of questions. But then again, like you said, those things come up during the appointment where I'm able to ask for clarification and make sure the patient knows what's going on, that the plan is really well spelled out, and ask those questions that the patient doesn't even know to ask, whether it be what are the complications or what does the recovery look like, etc.
Yeah. I know that you have put together like a checklist for people going into cardiac surgery. So what are some of the key things they need to be thinking about?
Yeah. So I have a cardiac surgery guide that's free to download. And a lot of it just goes over, these are the questions to ask your surgeon. what to expect during the post-op recovery, where you're going to be, because that's such a fear is, what's my room going to look like? What kind of tubes and lines am I going to have? So that's spelled out in there. There's a surgery packing checklist, what kind of things to take to the hospital, because there's a lot of things people don't think about, like entertainment. They should bring their iPad or a book because there's a lot of time just laying around recovering. And then the post-discharge list, what do I need to have at home to be ready to come home and recover?
What are some of the other little silly things that people don't think about when they're packing to go in for surgery? I love the entertainment idea. Probably headphones, right?
Headphones, earplugs, if you're a light sleeper. If you have CPAP or if you have sleep apnea, bring your CPAP machine. People forget about that. Any just comfort things. Bring a blanket, because it's nice to have a nice warm blanket on your bed when you're recovering. The hospital linens aren't always fantastic. And then, little snacks and just things that make you feel comfortable is really good, because it's such a sterile, icky environment sometimes. And so to have those little touches of home to make you feel better, it's really important.
How many 60-year-old big buff men do you see come in with their little Geeky blanket?
Oh, so many.
Or their stuffed animal that they've had since they were a child?
Yes. It's those little things that just make you feel better. So
I love that. Are there any, if you're headed into cardiac surgery, are there any lifestyle changes you should be making, or what are the things you should be doing to kind of prepare from that perspective?
So definitely, your doctor will give you a checklist, but there's certain medications that need to be stopped before surgery. So that's one thing I always go over with my clients. Well, what medications are you on? Let's make sure your doctor knows all of them, because there's certain ones that are really important to be stopped. And then, of course, smoking. If you smoke, stop smoking now or cut back, because that really will impact the way you heal. And then I just tell people to make, small, healthy changes. Make sure you're eating a good, healthy diet. Getting those nutrients in before surgery is really important. High protein, because the more protein you have, the better you heal. That's something I really always talk about. And then just making little changes to your daily activity level. Just increase your activity just a little bit, even if it's just a walk around the block, because the better shape you go into surgery, the better you'll feel.
Yeah.
And of course, check with your doctor before making any big changes. Make sure it's okay to keep up the activity levels, because there's certain cardiac diseases where they want you to just calm down. So,
yeah. So after surgery, what does that look like? What does the rehab or, the getting better phase look like?
So immediately after surgery, most patients go to the ICU, and that's usually only a couple days. And then depending on what the surgery is and, how you were before, your health levels, usually it's a few more days in the hospital. So the recovery, I tell everyone, happens at home. So, the hospital is just making sure that you're recovered, that your labs look good. And then once you're stable, you go home and you're going to keep eating right and keep those exercise levels up. Yeah.
Is there physical therapy that usually happens? I guess it kind of depends.
Yeah. So most of the time, physical therapy will see the patients in the hospital, get them out of bed and moving. That's so important after surgery, is just to be up and moving, even if you don't feel like it, even if you're tired and in pain. And then usually patients will go home with home health and physical therapy, and they'll visit them at the house after surgery a couple times a week. And then generally after that, they follow up with their cardiologist, and the cardiologist clears them for what's called cardiac rehab, where it's more intense physical therapy to get them up and moving again.
Okay. And so how long until you're sort of back to normal, or does it vary?
It really varies, but generally I say 6 weeks to be, almost back to your normal. That's when, if you had a sternal incision, that's when we say that's about healed. And then I tell most people about 3 months until they're really feeling back to their normal selves. And that's one thing that I feel people have a hard time with, because they want to feel better right away. And I have to remind them, you just had a really big heart surgery. Give yourself grace, let your body heal, keep moving. We want people to keep active, but especially my people that were really active before surgery, I have to hold them back a little bit. You're not going to go run marathons the week after surgery. So really take your time.
What about pain management? I know that's such a big concern for anybody heading into surgery. How do you kind of help with that? What are your recommendations?
Right. And that's one of the big things I feel like having an advocate there for is helpful, because a lot of patients don't want to bother their nurses or feel like they're, getting in the way or taking up time. And I always tell people, pain management is so important because you need to have that pain controlled in order to move and take deep breaths and start feeling better. And so really staying on top of your pain is so important, and letting people know when you're in pain or when the pain starts so you can get ahead of it. And having someone there to kind of call a nurse over, hey, my patient's in pain. Can we get them something? And there's so many different things. If you don't want to take narcotics, that's something you can bring up with your doctor. But there's so many different things you could do, from Tylenol to hot packs to, icy hot. There's always something that can be done to help deal with the pain. And most of the patients these days are getting like an IV, like nerve block, that helps during surgery. So if that's not offered, ask about it, because that can really control the pain within the first couple of days of surgery.
Very cool. How do you help work with clients at home, right? During the recovery process? I have to imagine that's just as an important part of what you do as the actual being there during the surgery itself.
Exactly. And it might be even more important, because I feel like sometimes patients, once they get home, they just feel so lost. And so it's nice for them to have someone to call and talk to and say, hey, I'm experiencing XYZ symptom. What does this mean? Is that something that I need to go see my doctor about? And sometimes it's, yes, you need to go to the emergency room and get that checked out. Or other times it's, no, that's a normal symptom, and you can do this to get through it. And then really setting up the post-op follow-ups, I feel, are so important. And patients feel lost after that. Who do I call? When am I supposed to see these people? Should I see cardiology? Should I see my endocrinologist? When do I do that? And so a big part of my job is to communicate with all these different specialties and make sure that they know what happened with the patient, and, when to follow up, and what medications changes were done, and what needs to be followed. And that gets missed a lot of times post-op, because the patients don't know they're supposed to follow up and do these things and do the cardiac rehab. So it's really nice to have someone, a patient advocate, that knows what needs to be followed up on and can help communicate that with the other providers.
Yeah, what would you say to families who feel like they need more support, but they're not getting it, either the families or the patient?
I'd say ask questions, reach out and see what kind of services are available to you. And then patient advocates are so great, and they're available for all different specialties, but going through surgery by yourself is really scary. And so it's really nice to have someone by your side that knows what's going on and can help you, guide you through it.
What are some of the most common mistakes you see patients and families making as they're heading into surgery, either mistakes or just oversights, right?
No, that's a great question. I think one of the biggest mistakes is just not asking questions, being unsure and not reaching out to your doctor to ask, should I stop this medication? What time should I be there in the morning for surgery? What tests do I need to have done? So that's one of the major things, is just making sure you're prepared and know everything going into surgery, rather than getting there and being lost and being scared and fearful and anxious.
Yeah. Speaking of that, what are some of the questions? You're saying ask a lot of questions. What are some of the questions? And this might be a whole other podcast in itself, but what are some of the key questions that people should be asking?
Yeah. So I think, who's going to be in the OR? Who's going to be taking care of me afterwards? What surgery am I having? You'd be surprised. So many people are saying, yeah, I'm having heart surgery, but I don't know exactly what they're doing. So I think that's really important is to make sure you know exactly what is happening to you and what the recovery is going to look like. You know, ask how long you're going to be in the hospital. Ask where you're going to be in the am I going to be in the ICU for how long? And of course, you know, the doctor's not going to be able to say exactly what's going to happen because we never know, but they're going to be able to give you a good idea. And then I think another thing people don't do is asking what services are available. Home health nursing is always there. Social work's always there. So just make sure you ask and get everything that you need.
Yeah. Yeah. How can listeners get in touch with you? How can they access you if they want to learn more about how they can have you as a patient advocate to help them? How do they get in touch with you?
So you can reach out to me at my website, www.platinumpatientadvocates.com. That's where you can find my cardiac surgery guidebook and then any information to book an appointment. I do free initial consults just to see if we're a right fit. And then there's a ton of information on there from blogs to just information about my services.
Awesome. Thank you so much for being on Heart of the Hustle. So excited to have you here all the way from Montana.
Thanks for having me. This was so fun.